Good afternoon, everyone. My name is Paul Biedritsky. I serve as Director of Disease Control, Environmental Health for the City of Milwaukee Health Department. Today, the Milwaukee Health Department received 5,000 doses of H1N1 vaccine, including a significant amount of injectable vaccine, which we've been awaiting for a while, and will target high-risk groups in 2 public clinics that will hold this week. One will be held on Thursday at Sarah Scott Middle School between the hours of 2 and 7 p.m. And the second will be held Friday, the next day at South Division High School between the hours of 4 and 9 p.m. The purposes of these clinics will be to target high-risk groups, those individuals that are at risk for severe disease or complications of disease. And those groups include pregnant women, children and young adults 6 months through 18 years of age, healthcare workers with direct patient contact, and then household contacts or caregivers of young infants 6 months or under. Now, we understand that other local public health agencies and perhaps even private healthcare providers have also received their allocation or a portion of their allocation of H1N1 vaccine within the last couple of days. These clinics are designed for City of Milwaukee residents in those high risk or target priority groups. Individuals outside of the city should contact the local public health agency for dates, times, and locations of clinics, or call 211 and we'll be able to give them information as well. We're seeing a rapid increase in influenza-like illness here in southeast Wisconsin. We saw a marked increase in hospitalizations over the last week, up almost 100% from last week. So we went from 13 hospitalizations last week to currently 25 hospitalizations, a majority in persons ages 24 years of age and younger. So that's, again, of concern. The CDC has also reported over 114 pediatric deaths just last week, 19 of those occurring in a short week span. So again, very disturbing. These are young children, some of which are healthy, that have succumbed to severe disease or consequences of disease associated with H1N1 flu. So we're urging, again, these high-risk groups to avail themselves of vaccination. The City of Milwaukee today received 5,000 additional doses of H1N1 vaccine, including the injectable version. We can combine that allotment with remaining doses from last Friday's clinics and hold 2 new large public vaccination clinics this week. Again, the first being on Thursday at Sarah Scott Middle School from the hours of 2 p.m. to 7 p.m. and the second at South Division High School from the hours of 4 p.m. to 9 p.m. and that will be on Friday. So we're very pleased to announce that injectable H1N1 vaccine is available. We want to target those high-risk groups, people most susceptible to severe disease or complications, and we're confident that additional vaccine will be made available in the coming weeks, and everyone that wishes to receive vaccination will eventually be able to receive it. So again, we're asking people not in those high-risk groups to defer or forego vaccination until we can meet demand for those high-risk groups. And again, these clinics are held for City of Milwaukee residents, particularly in those high-risk groups. We're hoping to continue vaccination clinics in the coming weeks. So with that, I'll open it up for questions.
Paul, given the effect on children, what advice can you give for parents about how they can keep their kids safe? You talked about these high hospitalization rates for children.
Yeah, again, children are at high risk for this disease for reasons we can't quite understand, including healthy children. So children that are sick should stay home from school, obviously. If they're experiencing symptoms of fever, low-grade fever, 100 degrees Fahrenheit or more, sore throat or cough, if these symptoms don't resolve within 1 to 2 days, they should seek care from their healthcare provider. If symptoms worsen, difficulty breathing, dizziness, dehydration, they should seek care from the healthcare provider. And again, if these young children have underlying health risks, including diabetes, asthma, respiratory cardiovascular disease, consultation with the medical provider is warranted.
Is this week's shipment a sign that we're going to soon have as much vaccine as we need? Will this vaccine continue to keep coming in at a pretty good rate now?
I'm very, very hopeful that will be the case. Initially, I thought we'd receive our next allotment sometime in mid-November to late November. This is very encouraging that we received, albeit a small allocation this early in November. I'm very confident and really optimistic that we'll continue to see both injectable, intranasal vaccine available here in the City of Milwaukee, and we'll stand up clinics very quickly. We're standing up these clinics within 48 hours of being notified. We We just, again, received notification from the state of this 5,000 dose allotment literally a few hours ago.
Was anything done to get more injectable this time around?
No, we put in an order, a large order for injectable vaccine because this is absolutely necessary to target these at-risk populations, including pregnant women and very young children. So we put in orders for tens of thousands of doses. This is, again, our first significant allocation of injectable H1N1 vaccine.
Why now? What's changed?
Again, I think some of the distribution and production delays are obviously being solved. Again, the state is responsible for placing orders on behalf of private and local public health agencies. So again, this is very encouraging. I think some of these distribution and production delays are being solved.
How much vaccine do you think is available in the area? Have you heard from local health providers, not public health providers, but the hospital and clinics groups about, are they also getting more vaccine?
Yes, anecdotally, I'm hearing that both private and public health care providers are receiving, if not their entire allocation, a fraction of the portion of that allocation. Again, very encouraging. This vaccine can be made available from private health care providers, and that's very important to note. Public health providers have typically focused on young children, those highest at risk, and individuals need to understand that private health care providers will also have access to this vaccine, if not now, very shortly, and that would be a good venue for many patients to receive their vaccination this fall and winter.
Just to clear it up, will you be checking IDs then for these two clinics to make sure it's just City of Milwaukee residents?
No, we won't be checking IDs, and we haven't done that in the past. We're encouraging, again, individuals who live in the city and are part of these high-risk groups to attend and others to defer or forego vaccination. We will not be checking IDs.
How will you try and ensure that it is only the targeted groups here that are getting the limited vaccine the City of Milwaukee has?
Yeah, it's very difficult to do, and we don't want to make this an onerous and difficult task for the public. This vaccine is to be made widely available to the public, first come, first served basis, on a voluntary basis. Again, it's a free vaccine. We want to get it out as quickly as possible, and therefore we don't want to establish or create barriers that would, again, challenge individuals from receiving this vaccine. So we're really relying on the goodwill of the public to comply with our, again, preferences in terms of who needs to get vaccinated in these high-risk groups.
Can you repeat the target again, as they have shifted some of the ages over the last few weeks?
Absolutely, and this is really a subset of those initial priority groups because we have a limited supply of vaccine. So it would include pregnant women, it would include children and young adults 6 months of age to 18 years of age. It would include household contacts or caregivers to young infants who can't receive the vaccine, infants 6 months of age or younger, and then healthcare workers, particularly those with direct patient contact, because that is a risk of transmission to some of the most vulnerable.
How far do you think this shipment actually goes toward meeting the need and the demand?
Well, this is small. When the CDC initially outlined the priority groups, we were told that this represented over 50% of the U.S. population. So this won't go very far, but it's a start. And again, we are anticipate receiving additional vaccine in the coming week. And this is a good sign right now. We'll continue to stand in the clinics and make them available to the public and eventually open it up to everyone who wishes to receive vaccine. And that's very, very important.
Paul, you initially wanted 160,000 doses. Was that the initial?
Well, I did. Actually, again, our allocations, our initial 3-week allocations was about 50,000 doses of both intranasal and injectable for the first 3 weeks of our campaign starting mid-October. That's changed now due to production and distribution delays.
All right, but do you feel you've gotten your fair share?
I think it's what we've received now is very reasonable and in line with what we're hearing other local public health agencies have received in the past.